Hello, I'm interviewing Mary, who is a physician's assistant, and she's going to tell you a little bit about her background, how she became a physician's assistant, starting with educational background, and then we'll get into some significant points about being a physician's assistant. So, Mary, would you tell us a little bit about your educational background and how you came to be a physician's assistant?
Sure. So traditionally you go through the normal undergrad process, so 4 years of an undergrad education, usually in a science focus. Some people do pre-med, other people do just a general science background. And then from that point you enter the graduate level, and that program is for usually about 2 to 3 years depending on the PA program, but mine in particular was a little over 2 years. And so it was broken up into 1 year of classroom work, so all didactic, different semesters focusing on different medical areas of medicine, and then the second portion of the course or the program was doing clinicals, so doing a full year of clinicals in different areas also of medicine, and then a third semester or last year technically of doing just kind of some other coursework to finish it up.
Well, can you just tell us a backtrack in the undergraduate? What science courses did you need to take before you applied to the graduate level PA program? So you're saying you got into your PA program on the graduate level.
So I actually applied on the high school level. So I did an entry-level program. There are some programs where the entry level actually makes it so that your program is a year less, so you'll only do maybe a 5-year program or something like that. But mine was still the full 4 undergrad and a little over 2 for graduate school. For undergrad, because I was in that entry-level program, most of my curriculum was already picked out for me when I entered the program, but there are certain prerequisites depending on each graduate program that you need. So sciences include in your freshman year general basic bio and chem, and then your next year you typically do organic chemistry, and then you have to do a biochemistry course as well. Usually for at least our program, you only had to do 1 physics semester versus 2 for some other programs. And then I did a lot of I don't know if this is unique to just my schooling, but we did a lot of individual science courses, so things like endocrinology, histology, we had a cardiology class, it's kind of more specific undergrad science-based courses, microbiology, things like that.
What program did you go to?
Quinnipiac University.
Okay.
Yeah.
So you were there all 4 years. Did you know any people who transferred in after 2 years? They were in another college, maybe a junior college, and they transferred in to Quinnipiac?
At Quinnipiac, they had kind of a closed program for PA. So on the undergrad level, for that entry level type program, you could only do it at the high school level, and then from that point you could not, it wasn't, within the different sciences like physical therapy, nursing, you could transfer into those programs undergrad, but you could not transfer into the PA program. It was the only science program that you couldn't. But then on the graduate level, that's when new people came in.
I see. So there are other people who came in to the graduate part of the PA with the same prerequisites, but maybe from a different school.
Correct. That, or just not only different schools, but just had a lot more clinical backgrounds, because the graduate level, they expect a lot of hours to apply on the graduate level. So Quinnipiac usually requires at least 2,000 hours of clinical experience before you can even apply or be considered. So they were people that were, a couple people were nurses before, some were EMTs, paramedics, phlebotomists, medical assistants, clinical psychologists. There was one of those in my program.
I see.
So a lot of different people that come in, usually late 20s, early 30s, that enter on the grad level.
I see.
And then
So they were working a long time in the field.
Some of them,
yes. And then took the courses and then applied on the graduate level to that particular
Correct.
Program.
Most people had to take at least a year off after undergrad to get those clinical hours before they could apply to the graduate program. Mm-hmm. So most had at least a year or 2 off before they went back.
Okay, good. So tell us a little bit about what you do now as a physician's assistant. What are the different jobs you've had? What's your current job?
Sure. So within a little over 3 years of experience, I've had a lot of different jobs so far. So kind of a long question for me, but I started in the emergency room at Stanford Hospital. I worked there for a little bit, and that involved anything from fast track patients, so seeing more of the urgent care type patients that were coming through, to the more critical, acute patients in the main part of the emergency department. And that was anything from, evaluating them on the way in, determining treatment, ordering diagnostic testing, imaging, labs, interpreting them, getting the appropriate consults, and then also, figuring out their disposition, either admitting to the hospital or sending them home. And then from that job, I went to an orthopedic practice. So I worked in an outpatient setting in an office. My typical week involved doing a couple of days in the office and then being in the OR a couple of days a week. Also taking call overnight, first call for the surgeons, and on the weekend. So that involved going in for new consults, doing reductions, putting the bones back in place if that needed to be done on an emergent basis. First assisting in the operating room, and then also being in the office, seeing patients on my own schedule, but also helping the physician with his patients, doing different procedures, injections, things like that. And now my current job is now my third job, and now I'm doing inpatient surgery. So I'm doing mostly managing patients on the floor that are either admitted with a surgical problem that would potentially need surgery, or someone that is post-operative, after they've had the surgery, now they're being admitted for a certain number of days before they can go home, and managing any, adverse events or complications from the surgery. I do also first assist once in a while in this job, not as frequently, but still
in the OR,
in the operating room.
Yep,
keeping up with
OR.
those skills.
Yep.
Yep.
Okay.
Yeah.
Good.
And I still do per diem in the ER as well.
Okay. And you have a license. When you finished your graduate program and had the hours, did you have to sit for a licensure exam?
Yes, so it's a certification exam. So we get our certification. It's a national certification. It's called the PANCE exam, the PA National Certification Exam. And then every 10 years after that, it's called the PANRE, where it's the PA National Recertification Exam. And that's done every 10 years. For the initial certification, that's on a national basis. So every PA needs that in order to practice. A license is specific to the state regulations. So not every state requires a license to practice as a PA, but the majority do, and they're working towards that. I think it's close to 40-something out of the 50 states you require a license. So it's two different things. So for instance, in my second position, I was first assisting in a surgical outpatient center in New Jersey, but I was working in New York, and then I was doing per diem in an urgent care in Connecticut. So I needed 3 different licenses in all of those states to practice.
Mm-hmm. Good. Okay, good. What do you like about the work environment in terms of your particular focus in your work? What are the things that you like about it?
I just like being able to have exposure to multiple things. My favorite part about the profession is being able to, assist the physician, but really have them entrust you and train you and get more autonomy as time goes on. So the more that they kind of take an interest in you and you learn from them, the more you can do within the profession. But I like the fact that as a PA, I think I have a lot of time to spend with the patients, with the family. I like kind of being that connection between, kind of that link of communication between the surgeon and the patient, and trying to help answer patient questions and things like that. And I just love the variety of what you can do. And how much you can do as a PA, in terms of what the surgeon's doing. They put a lot of trust in you to do a lot of things that they, just don't have time to do nowadays.
Mm-hmm. Okay, a lot of choices in the field, too.
Yeah.
Do you feel that the compensation earnings are good in terms of where you are in your profession?
Yes, definitely. I think there's a lot of room to grow for that. And I think as long as you're educated on, what you can potentially get within a certain area of medicine. I think it's just important to advocate for yourself and negotiate. But the PA, actually the National PA Association, the AAPA, they put out a national PA report based on surveys that different PAs in different areas of the country answer. And based on that, you can look at tables of, how many years of experience you have, what area you're working in, what part of the country you work in, and you can see kind of where you should fall on that spectrum. and hope that compensation is appropriate. So I haven't had any issues with that so far.
Good. Okay. What are some related occupations that you come in contact with as a PA? Who are you? I mean, you mentioned the physician, but who else are you interacting with in terms of the team?
Yeah, certainly. I think on an inpatient basis and in ER, it's very heavily important to work with the nurses. That's a huge part of the team. Understanding, because they're with the patients most of the time, so understanding what's going on, on an hourly basis is very important to communicate with them. There's also techs that you work with within an ER setting. So if I need, vitals repeated or I need certain things done, then you speak with the techs. Physicians, nurse practitioners are a huge part of our service as well. But then also the social workers and case managers are a huge part of what goes on. Medical assistants, so a lot of different people.
Good. Okay, good. All right. Okay, I think, thank you for your time, and I think we're good.
All right, thank you.
Thank you.